We are going to get started with our, oh great, so we're recording this meeting. We will actually be starting in about another minute or so. I'm seeing the numbers of our participants climb pretty rapidly. So for those of you who have joined us, wonderful, and I'm so glad to have you with us this afternoon for the webinar. And we will be back shortly to get started in about a minute to 2 minutes. Thanks so much. All right. Good afternoon and welcome, everyone. Thank you for joining us this afternoon for our webinar. My name is Meg Beyer, and I work for the Managed Care Technical Assistance Center. I'm based out of the McSilver Institute at NYU. I'm excited that everyone's able to join us this afternoon. And before I pass along to our presenters from DOH and OMH, I just wanted to run through a few of the logistics for the webinar this afternoon. So for those of you who have joined our webinars in the past, you know that we record and post the webinar recording and the slides within about 48 hours of the actual webinar itself. So check back by Friday. We should have these slides and the recording posted to the MCTAC website, and that can be found at mctac.org. Also, to remind everyone, there will be time for question and answers after the content portion of the webinar today wraps up. So I would like to encourage everyone to send in your questions through the chat box functionality, which is on the right-hand side of your WebEx screen. Please feel free to start chatting them in right now. We will collect all the questions we can and try to answer them as best we can. If for some reason we're not able to answer a question on the webinar today, we'll take it back and try and answer it later on. And just to encourage everyone, we'd like to be answering questions only related to the topic at hand today, which is enrollment of Medicaid managed care behavioral health providers in Medicaid. So with that, I want to thank again everyone for joining us, and I would like to pass along to our presenters from the Department of Health and the Office of Mental Health.
Do you want me to talk through this? Sure. Okay. Yeah, this is Lynn Schaefer from the Office of Mental Health, Division of Managed Care. I'm joined by my colleague, Sue Zalesniak from the Department of Health, Provider Enrollment Bureau. And so, yeah, we're going to walk through this presentation, which is a small slide set that talks about how do folks enroll in provider enrollment in fee-for-service Medicaid. And so we'll go to the next slide. So here's our agenda. We'll talk about what this is about. We'll talk about the fact that an outreach letter was sent out. We'll give you some insight on some of the feedback we got from providers. Very specifically, the categories of service for behavioral health providers that must enroll, and enforcement of enrollment requirement and terminations. And then just briefly, there's also information on where you can find frequently asked questions, our website, a phone 800 number for any additional questions about provider enrollment, where to find the forms, et cetera, are the last few pages of the slide deck. So as the screen says, the 21st Century Cures Act requires all Medicaid managed care providers and the CHIP program providers to enroll with the state Medicaid programs by January 1st, 2018. And specifically, it requires, at a minimum, the information you see on your screen. I just want to say something about this. A lot of folks enroll in to be a provider with Medicaid, and they don't want to give their date of birth or their Social Security number. These are critical pieces for the program and for program integrity. We screen all providers to ensure that they are the right providers to be enrolled in the program. There is, you know, they've not come over from another state having committed some kind of fraud or abuse, you know, elsewhere. Now they're coming into New York State and setting up shop, and you know, they're a provider, or that they don't have any business dealings fraudulent business dealings, either where they are in New York State or elsewhere in the country. So we have several databases that we run provider names and owners of businesses and managing employees. We run all the names and this detailed information against several databases. So we need this information for that reason, because we are now screening to make sure, again, that the right providers are in Medicaid. Next slide. So what we did was we spoke to all the plans and sent them information and asked them to send notice to providers that that are not enrolled as active fee-for-service Medicaid providers, that are not actively enrolled, and those that were able to enroll. And we have a list of who are able to enroll on our website, and that information, the website, will come up later. What actually happened was a lot of plans just went ahead and took their entire mailing list and sent out letters to everyone and said that they had to enroll in fee-for-service Medicaid, and gave all the good information, which is problematic because there are providers who do not need to enroll, who can't enroll, or they're not enrollable providers. And it was probably confusing for those providers that were that were active in Medicaid and had an active Medicaid provider ID number, and they're getting this letter saying that they have to enroll. So the next slide actually highlights for you folks the two behavioral health programs that are able to enroll in fee-for-service Medicaid. And that is the CSWs and the Children's Home and Community-Based Services that originates with OMH. Those are the only two providers that are able to enroll. And I know that right now there's, for the CSWs, one of the requirements is that they are required to enroll in Medicare. So for those of you who are not enrolled in Medicare, and you need to enroll in fee-for-service Medicaid, my suggestion is to begin to become enrolled in Medicare. There's an application. It's on the CMS website. So become enrolled or begin the process to become enrolled in Medicare. And when you do that, you'll get like a receipt, like your application is pending or it's been received. Print that out, and you're going to use that as part of your Medicaid, your New York State Medicaid enrollment package, because the enrollment documents you're going to complete ask for your Medicare number. And if you don't have one right now, you're going to be in the process of getting one, and you're going to let us know that by putting in a copy of that Medicare confirmation letter that the confirmation document that you receive from Medicare. Because what actually happens is we receive a lot of enrollments, and there are certain providers who must be enrolled in Medicare prior to enrolling in Medicaid, and they're not. So what we end up doing is we get in the application, and then we promptly look through everything and recognize no Medicare. We can look it up. We have access to the federal CMS system, and we send them a letter and give them 4 months to enroll in Medicare. So, obviously what the 4 months is going to do is if you take that long, or if for some reason it does take that long, it's just going to delay your enrollment in Medicaid. It doesn't mean you can't or you won't be able to be enrolled in Medicaid. It just delays it. So for those folks who are not enrolled right now, look at it as a concurrent process, enrolling in Medicare and enrolling in fee-for-service Medicaid. Actually, what Lynn did was pull up a, I don't know if you folks.
They probably can't.
I don't know. Okay. So Lynn pulled up for us, 3 of us in this room, our screen on emedne.org. We'll get to that, and that will be a, we'll get to that, and there'll be also, there'll be a reference to the eMedNE website. So the other thing about our slide right here, let's see, we'll go back to the slide, thanks, is that the ACT provider agencies, the PROS provider agencies, and the outpatient provider agencies should be also listed on this slide, and they're not, because those are enrollable agency types.
And we'll update the slide before we post it.
Okay, that's great. Okay. So how to identify if a provider, if you're already enrolled in fee-for-service as a provider. You can go to, there's the actual website link right there. You're going to go to the information, and it'll say OPRA. OPRA really, all that stands for is ordering, prescribing, referring, and these are non-billing types. And if you are a type of provider that never plans on directly billing Medicaid, you will complete a OPRA, or in other words, a non-billing application. It's a few pages less, but it is almost identical to the billing application. And once you get in there, for your type, you'll see it'll actually say, do you want to be a OPRA provider or a billing provider? And depending on whether you will, what your situation is with your managed care plan, and if you'd ever like to be a billing provider, you can choose, either one. Choose the one that's applicable to you. It actually doesn't matter if you enroll in one or the other. You'll be able to obtain a provider ID, and that is actually the goal, is to have everyone in the managed care plans have a provider ID with Medicaid. And if you're a business, a group practice, or an institutional provider, give our eMedNE call center a call and ask them if they can verify their enrollment. And you can go by a couple of things. You can go by an FEIN or the NPI. Okay, so the enforcement of enrollment requirement, we really actually have no enforcement plan right now, and that's because we're still waiting on guidance from CMS, and they have asked us to have everyone enrolled by January 1st, 2018. And we're working on it. We're working with you folks on it. And I monitor our numbers every week, and our enrollments for the non-billing applications have jumped by 200 a week, and that's in the last 3 to 4 weeks. So people are already paying attention and enrolling. When we do find out what their enforcement strategy will be, we will provide this information to everyone. It will be on our website, which again is that emedne.org website, and you're going to look under provider enrollment. So that information will be there. And it won't be a surprise, and it also won't be put up a week before people will need to be enrolled. The way we've always done things, and I certainly can expect in the future, is that providers will be given a period of time in which to enroll before we say, then that's it. The claims will not be paid, or the managed care plans cannot use a certain provider when billing. Let's see. Should we just back? I want to read the last one. Oh yeah. Okay. So, and our instructions to the plans are not to begin terminating anyone until we give them guidance on the enforcement date. And so really their focus is on to be getting folks enrolled. Okay, a few bullets regarding about what's next. Practitioners who only want to service patients through a managed care plan can enroll as a non-billing OPRA provider. This is actually something I touched on previously. Someday soon I'm going to get the word OPRA out of there because non-billing is a better generic term, and it really is a better descriptor of what that provider type is. You'll be able to see the forms and choose the correct forms. If you're just looking for non-billing, that information will be on there too. Businesses, group practices, and institutions may also enroll as a non-biller by checking the appropriate box at the top of their application. Enrollment in fee-for-service Medicaid does not require them to accept, obviously you folks, the providers, does not require them to accept fee-for-service Medicaid patients. Now, certainly if a provider is a non-billing provider, they can't accept fee-for-service patients because there's not a mechanism to bill. But if for some reason a provider does sign up to be a billing provider and wants to go that route for some reason, maybe some future reason, there's no obligation to accept fee-for-service patients. If you want to be listed as a billing provider, if you want to provide that information, and you still only want to work for a managed care plan, that is fine. We guess that a lot of providers already are billing Medicaid providers, and those folks do not have to enroll at all because they've already been enrolled in Medicaid fee-for-service. They have a provider ID, and they're all set. We have screened them, we have verified their credentials, and we have approved their enrollment. If you were a Medicare provider at one time, fee-for-service perhaps, or even a non-billing OPRA provider, you may be able to keep your original provider ID, also known as an MMIS ID, by checking the appropriate reinstatement box at the top of the application. And if you don't know or you forgot the provider ID, just make a note, provider ID unknown, but I'm pretty sure I was a provider before and I'm reinstating. Frequently asked questions will be this is obviously a resource located at emedney.org that will continue to be updated on an ongoing basis, so that any questions, any fresh information, the information on enforcement and termination will be put in there, and it'll be available to everyone who visits the website. So for assistance with completing the enrollment forms, we ask you to call our call center. It's the 800 number listed on the slide. For general enrollment questions, you can email our provider enrollment mailbox. We try to get back to people within a week, so don't panic if you don't hear from us right away. The auto response on that mailbox is a collection of good information, so you may actually want to print out the auto response you receive and use that to dig around for some answers to your questions. For OMH specific questions, there is the mailbox listed right there, also on the slide. Okay, is that the last?
I know it. Yep, that's it.
Okay, so 10 slides done. Looks like there's a number of questions.
Too many though. Yes.
All right. So thank you. This is Meg again. Would it be helpful to our presenters if I started to read through some of the questions that have come in?
Sure.
Great.
Fine with me.
All right. Okay, so one question that came in is people are wondering if any of this information is applicable to Oasis licensed designated adult behavioral health HCBS providers.
Well, Megan, that's a great question because we know that the children's program is available, and it's on our index page, and it is titled Children's Health and Behavioral Transformation. I am working with or will work with OMH to also enroll the adult program. So at this point, the adult program is not an enrollable provider, but the children's program is.
Got it. Thank you for that. And just to, okay, so moving on to our next question.
Oasis.
Oh,
yeah. Oh, wait a minute.
So
you know what, Megan? I just saw this slide. It just said it's an Oasis licensed designated adult BH provider. Actually, could we go to our screen, Lynn? So
The only Oasis.
Yeah, the only OASIS program on there is a Part 820 residential treatment program.
Thank you for clarifying that. Okay.
Yeah, you're welcome.
All right, so for the individual that asked that question, again, just to repeat the answer, the only Oasis service that is eligible, or I'm sorry, program that's eligible is the 820. Is that correct?
And I just want to encourage everyone to go to the Provider Enrollment Index to look to see if your provider type is listed. That's how you know. If your provider type is listed, then you're eligible to enroll. If your provider type is not listed, you are not eligible to enroll.
Thank you, Lynn. Thanks. All right. The next question that I'll jump to, I think Susan had mentioned outpatient is required, and I think the individual is wondering what type and who is in that setting.
Okay, so we're at the provider enrollment page, and the licensed outpatient provider is, let's see.
Can I read that?
Yeah, is it an agency or is it a person?
This is an agency.
Okay, so it's an agency which provides an array of treatment services for assessment or symptom reduction. So this is an agency that would apply, not a specific type of practitioner.
So the OMH licensed outpatient and pros providers, those also have agency at the end of the name. That's going to be changed. So those are, we want ACT provider agencies, licensed outpatient provider agencies, and licensed pros provider agencies.
All right.
The others may be individual practitioner types.
Okay. Thank you for that. Our next question comes from an individual who's asking, our agency is already enrolled in Medicaid as a mental health community residence provider. Do we still need to enroll as a BHO provider?
What is a BHO provider? I'm not sure. A behavioral health organization. Only if that organization is a provider type that you also need, and where would that be?
Here, but I don't know that it's managed care.
Yeah. So that would be, is it part of the managed care program? That would be the question. And Lynn, perhaps you folks could find that out for us, find that out for these folks? Okay.
So I'll make sure, and just as I see more and more questions coming in, which is great. So just to remind everyone, if there's a question that we don't get to today, or if we are unable to answer today, our wonderful state partners who kind of led us through the presentation are going to receive all of the questions that have gotten chatted into us. So they'll be able to take them back to their team and try and come to some answers, get some answers for us if we're not able to get to that on the webinar today. All right. So I'm going to move to the next one. Someone else is asking that it was their understanding that nurses, specifically RNs and LPNs, needed to apply as well. Can someone confirm that?
Well, nurses are part of our fee-for-service program, and if a nurse is working for a Medicaid managed care plan, they will need to enroll as a provider.
Okay. So now I have a question about MMIS numbers. So someone is asking if what the webinar was on today is in addition to the MMIS number that they already have as an agency.
Actually, if they already have an MMIS number, then that is what they need to have, and they don't need to apply for anything else.
Okay.
What I want to ask is if the agency, so the agency may already have an MMIS number, but if the practitioner is a practitioner type that can also enroll in Medicaid, we were given to understand that they also would have to enroll as individual practitioners, even though their agency already has the MMIS number. So if you have like an LCSW who works in a licensed outpatient provider agency, and the licensed outpatient provider agency has an MMIS number, does that LCSW also have to get their own?
Yes.
Okay. Thank you for clarifying.
Okay. So our next question is, folks are wondering if this includes practitioners who will be providing services under OLP or other licensed provider who will work under an agency NPI number.
Yeah, I think that's pretty much the same answer. If you are a provider type that is eligible to enroll, even if your agency already has an NPI, you still need to enroll.
Yes, and that's correct, Lynn.
Thank you. Okay.
Let's see here. I'm just sorting through because we've gotten some questions that it looks like we've already answered. Let's see. So, okay, this individual, provider, and if they're understanding this correctly, all of the LCSWs should be enrolled as OPRA providers. Is that correct?
That's correct if they don't ever plan on billing in fee-for-service Medicaid.
Okay. So there's a second part to that question. So in addition to the LCSWs, they have MDs, NPPs, and PhDs, and are wondering if they should be enrolled as well.
MDs, we do enroll doctors. Nurse practitioners, we do enroll nurse practitioners. And what was the other acronym?
PhD.
It would depend on what that PhD is and if they're listed on our provider enrollment page on the index. We enroll psychologists, and there are qualifications that may include a PhD.
And just to follow up about different provider types, so someone else is asking, do physical therapists, occupational therapists, and speech therapists need to enroll?
Yes, they do.
Yes, okay, thank you. All right. And again, I think folks are just, this might have come up, but just to clarify, is electronic enrollment possible?
Unfortunately, it is not. We are still a paper process, and but all that information can be found on our website. I do need to say that you can type in the information on your computer. You just need to print it and then sign it. So we're like a quarter of the way there. It is a fillable PDF form, but the form needs to be signed.
Great. I think another question, so another person's wondering if all social workers working in an OMH licensed mental health outpatient clinic need to enroll as a provider.
If they are licensed CSWs, yes.
So so there's LCSW versus LMSW.
Right,
so if
and only LCSWs are enrollable.
Got it. Thank you for saying, yep. I think that was, sorry, go ahead.
Yeah, currently we only enroll licensed CSWs.
Okay, great, thank you. And I'm just searching for our next one. Let's see here. People are, I guess there's a question, what form would be necessary to fill out to reinstate a facility provider ID or MMIS under a different COS code?
That's also a great question. You would have to go to the provider index and choose your provider type. And once you've done that, you'll see that there are a number of options often, and it actually asks you what you'd like to do. If you need to reinstate, choose the choice for what type of provider you'd like to be, whether you'd like to be a non-billing provider, a billing provider, or if you'd like to make that change. On those forms, there is a place actually on all the forms where you check if it's a new enrollment or a reinstatement.
Okay. Thank you for that. All right, so we now have a clarifying question to our question earlier that was about Oasis providers. So the question is, are we saying that all Oasis Part 820 providers, whether billing or non-billing, have to enroll in Medicaid, even if claims will be submitted under a medical director?
Yes. The answer is yes.
Okay. Thank you. All right. So this is a question from a children's provider, actually. So they're wondering if they need to receive the children's designation before they apply for an MMIS number. They've applied to be both an HCBS and SPA provider.
Yes, they do, because those letters or designation, certificates of designation, those are items that we look for in the enrollment package. Got it.
Thank you.
Yep.
All right. What happens with LMSWs who see patients? Are they able to continue seeing patients?
Well, that's up to the managed care plans.
Okay. Okay. Sorry, I think our OMH and DOH presenters might have cut out for a second. Did I miss an answer, or is it just that the individual would have to follow up with managed care directly?
Yeah, they'll have to, I'm sorry, they'll have to follow up with their managed care plan directly because at this time we do not enroll master social workers.
Got it. Okay, thank you. Let's see, another question came in, and I think the answer to, well, I'll let you answer this, but it ties in with the question we just had about LMSWs. So someone is now wondering if an LMSW can be billed under a physician MD.
You know, actually, I'm unfamiliar with billing on the managed care side. That's actually a question our billing folks would have to answer. So if we could use that as a question that, you know, we can look into, that would be great.
Sure. Great. Of course. Okay. All right. All right, and then again, thank you to everyone who's chatting in the many questions. I'm doing my best just to, some of the questions kind of are very similar, so I'm just trying to piece through and find some new topic areas to jump into. Let's see here. Okay, this individual is an Article 31 mental health outpatient clinic. They bill under the clinic NPI number. The LCSWs, MDs, and registered nurses are enrolled as OPRA providers. Is it necessary for psychiatric nurses to be enrolled?
Actually, yeah, if they do have to be enrolled if they're an RN or an LPN working in that program.
Great. Okay. So again, this is another question about MSWs. So with an agency, under an agency with all CSWs registered as providers, what would happen to those who are MSWs and licensed mental health counselors, LMHCs?
You know, Megan, this is a difficult question only in that we don't know what they're asking about, like what would happen to them.
They don't have to enroll.
They don't have to enroll, right. The managed care plan or the agency they work for, you know, they make their decisions. So that's nothing that's driven by provider enrollment.
Sure, got it. All right. Next question. And then I think this is just a clarifying question, but to clarify, does an agency have to enroll or do the individual providers have to enroll?
Yes.
Yeah, both, actually.
Both.
The agency has to enroll and the individual providers.
If they're enrollable agency types or enrollable provider types.
Right, right. Thank you, Lynn.
Yeah. So not every agency type is enrollable and not every practitioner type is enrollable, but if they show up on the provider index, the provider enrollment index, that's really the place to go to see if your agency and or provider type needs to enroll.
Okay, thank you. So now we've gotten another question about provider types, and if we could clarify which provider types this applies to and which staffing credentials needed to apply. So I think that was covered in some of the content of the actual webinar today, but it seems like information on eMedNI doesn't necessarily make this super clear. So we're just wondering if there's any way to clarify that right now.
Well, we have dozens of providers that we enroll, and there are many different qualifications. So there actually is no way that I could go through and talk to each type of provider. But I encourage the folks who are curious about the credentialing or what is required is to simply go to the website, the provider index, choose the provider type they are interested in looking at, click through to the instructions, and the instructions state what is required on the form and what is required to be sent in by the provider or the agency.
Great.
It's very specific. So it would be irresponsible of me to start to try to talk to all of those provider requirements.
Totally understand, and thank you for saying that. And again, like just as we've said before, we are collecting all of the questions that we can. We are answering what we can today, and what we're not able to, we'll either follow up on, or we'd encourage you, I think Lynn and Susan were able to list a bunch of different resources and contact information for people to follow up with if they had additional questions as well. Additionally, I think someone's wondering if MCOs are going to receive a listing from the Department of Health to cross-reference against at a certain enforcement date. So is there going to be a date where the MCOs would receive a listing from the Department of Health to cross-reference?
Yes, actually the managed care organizations have received 2 lists to date, actually, of enrolled active providers, and we will continue to send them this this list of providers. And so what they'll be able to do is, I should say the managed care plans will be able to do, is to continually review and see who is enrolled. Speaking to my enrollment manager this morning, she has a plan to ensure that as soon as the non-billing applications come in, that they are handled as a priority. And keep in mind, we get hundreds of enrollments, hundreds of new enrollments every week. And we have a terrific staff who sort these out and work through them. And again, they've been prioritized so that as soon as the non-billing provider applications come in, they are handled immediately. So that's our goal, is to assist by not saying, well, you know, you got yours in late and then, you know, you're going to have to wait until your number comes up. We're going to actually look at those and do those quickly.
Great.
So I hope that answers some of the question, is that we are providing that data, the feedback of who's enrolled to the plans. We're doing it at least every 2 weeks, so they're able to see who gets enrolled. And on our end, we are enrolling the non-billing providers as a priority.
Great. Okay. So with that, I actually think I'm going to pause on asking questions, and we have a robust list of things that I think we're going to take back and follow up on. I know in the past we have not only posted, as we always post the recording of this webinar and the actual slides as well, but occasionally when we get such questions as we've gotten today, we'll post a frequently asked question document. So if you have any more questions, do feel free to follow up with the resources that were listed on the slides, or you could always email MCTAC, our MCTAC email address, which is mctac.info@nyu.edu, and we'll be happy to facilitate getting those questions answered as quickly as possible. So I'd like to thank our wonderful presenters and see if they have anything else they want to share, and thanks to all of our participants for joining.
Thank you, Meg, for running the show. And thank you,
Meg,
for coming over to walk us through this. We really appreciate it.
You're welcome.
Of course. Thanks, everyone.